Let's get started with today's deep dive. We're taking a closer look at the iCoder app, something I know you're interested in, especially since you're looking for ways to, make your medical coding process a bit smoother.
Oh yeah, definitely a key part of, well, everything in healthcare.
For sure. And this iCoder app, it claims it can do just that, make things smoother, faster, all that. Yeah. We've gathered a whole bunch of stuff, their marketing materials, user reviews from people who actually use it, and then like the breakdown of features. Yeah. So we're going to dig into all of that and see if iCoder really is that time-saving tool you've been hoping for.
Yeah, it's a good question to ask. I mean, getting medical coding right, it's so crucial. It impacts so much from how claims are processed to, how doctors get reimbursed. Having the right tools to make sure it's done accurately and quickly, I mean, that's essential.
Absolutely. And right off the bat, on iCoder's website, they make this bold claim saying it can save users over an hour a day. That's a lot of time, but does that actually pan out in real life?
Well, think about it, an hour saved every day. That turns into more than 10 extra days a year. 10 days that, you could be spending with patients, catching up on research, or just having some time for yourself. For someone with your kind of workload, that time saving, that could be huge.
No kidding. Okay, so let's get into the nuts and bolts of the app. iCoder's got a whole bunch of features, like searching for CPT, HCPCS, those ICD-10 codes, organizing your, most used codes into favorites, and even calculating rates based on your specific GPCI location. Plus, they say the search function is pretty smart. It can handle partial words, even descriptions, which sounds pretty helpful.
Oh, that intelligent search, that could be a lifesaver, especially when you're dealing with those really complex cases. And it's not just about finding the codes. iCoder also includes those ICD-10 code edits, which factor in things like the patient's age and gender.
Right, right.
Really important for making sure you're picking the most accurate code. Ultimately, it all comes down to getting those reimbursements right.
Exactly. And then they've got this, almost futuristic sounding feature called Code Vision, where you can snap a picture of a code list and boom, the app gives you the results instantly.
Yeah, that's got to be a huge time saver, especially if you're still dealing with, paper records. Being able to digitize those codes quickly could make a world of difference. But of course, we can't forget the fundamentals. Technology should be a tool to support your knowledge, not replace it altogether.
For sure, for sure. You still need to understand the reasoning behind the codes, not just rely on the app to do all the thinking.
Okay.
Okay, let's shift gears and talk about those specialized tools iCoder offers. They have specific browsers for orthopedics and general surgery.
Yeah, and those specialty browsers, they're a good example of how iCoder tries to be intuitive and efficient. They get it, Different medical specialties have different needs, different ways of working, and they've tailored the app to streamline those specific processes. Like that orthopedic browser lets you quickly find codes for any part of the musculoskeletal system, which is, key for that specialty.
Right, makes sense.
Yeah.
And the general surgery browser, they actually go a step further with over 8 automated calculation tools specifically for that field. It seems like they're really trying to make those particular workflows as smooth as possible, which definitely aligns with your need for maximum efficiency.
Absolutely. If the app can take care of those tedious calculations and help you make sure you're using the right codes, that frees up your time to focus on what matters your patients.
Couldn't agree more. To get a sense of what actual users think, we looked at reviews on both the App Store and Google Play Store. And the overall feedback is really positive. Lots of people talking about saving time and feeling more productive. There are even reviews from medical residents using iCoder to log CPT codes during their training, which is pretty neat.
It's always good to see how these tools actually perform out in the real world. Those reviews really highlight the potential benefits. It is worth noting, though, some users did point out a couple of drawbacks. Some mention the app doesn't track RVUs, which might be a useful feature for some practices.
And, of course, being a mobile app, you're always going to be dependent on your phone's battery life. But those seem like relatively minor issues compared to the, potential time savings and increased accuracy iCoder offers. What really stood out to me is that iCoder has been around for 14 years. That's a long time, especially in the tech world, for a medical coding app to stay relevant.
It does suggest that, it's a mature, reliable product. They've had years to refine the app, gather feedback from users, adapt to changes in the industry. And in a field like medical coding, where accuracy is absolutely critical, that kind of track record, it's definitely reassuring.
Okay, let's talk about the elephant in the room, the cost. iCoder works on a subscription model, and their basic plan is $79.99 for a year. They do have standard or premium plans with extra features, but we'll stick with that basic plan for now.
Now, that yearly fee might seem like an expense up front, but you got to consider the return on investment. If iCoder truly saves you an hour or more each day and helps you avoid those costly coding errors, the increased billing accuracy, the time you get back,
Yeah.
that could easily justify the cost.
And they do have a free trial, so you can actually test it out in your own work
Yeah.
before you commit to a full subscription. That way, you get to see firsthand if iCoder lives up to its promises. Plus, when you compare it to some of the other coding apps out there, iCoder is actually pretty affordable, especially given its mobile-first design, which is a big plus for someone like you who's always on the go. You can code from anywhere, the hospital, your home office, even between appointments.
Yeah, it reflects how our work habits are changing, We're not tied to our desktops anymore. iCoder brings that same flexibility to medical coding, which is, I think, pretty cool. It's bridging that gap between the traditional coding methods and the demands of today's fast-paced healthcare world.
And speaking of today's demands, let's talk about security. I know that's got to be a top priority when dealing with patient information, especially on a mobile device.
Absolutely. And it looks like iCoder is taking security seriously. Their website says they don't actually store any patient data on the app itself. You can create a secure account or even sign in using your Apple, Microsoft, or Google account, and they use encryption to protect your data while it's being transmitted.
So they've definitely taken steps to address those concerns. All right, we've covered a lot of ground here. Features, user feedback, the cost, security. But let's take a step back for a second. What does all this actually mean for you and your coding workflow?
That's the million-dollar question, right? When we look at the bigger picture, it seems like iCoder is trying to tackle a very real problem, the need for accurate and efficient medical coding in a healthcare system that just keeps getting more complex.
And from what we've seen, they seem to be on the right track. They've got a long history, positive reviews from users, and a solid set of features designed to simplify your coding process.
But it's more than just the technology itself. It's about how that technology can empower you, help you work smarter and gain back some of that precious time we talked about. Time you can then spend with your patients or just keeping up with the latest developments in your field.
Absolutely. Makes sense. So where do we go from here? What's the next step for someone who's intrigued by iCoder and wants to explore it further?
I think the first step is to, really think about your own coding workflow. What are your biggest pain points? Where are the areas where you could be more efficient? Once you've got a good grasp of your needs, then you can see how a tool like iCoder might fit into the picture.
And as we mentioned, they do offer that free 30-day trial. That's a great way to test drive the app, try it out in your own work environment and see if it lives up to the hype. You can really get a feel for whether it's the right tool for you without any commitment.
Exactly. Give it a try, see how it works within your own workflow, and then make a decision based on your own experience.
Now, before we wrap up, I'm curious about your thoughts on, the future of medical coding in general. We've seen how iCoder is using mobile technology to kind of shake things up. But what other innovations are on the horizon? What might the future hold for this field?
That's a great question to think about. It really feels like we're at the very beginning of what technology can do for medical coding. Apps like iCoder are really paving the way for a more mobile and connected healthcare system. And I think that's bound to lead to some really exciting innovations down the road.
So we could be seeing even more, sophisticated tools in the future. What might those look like?
Oh, absolutely. Imagine AI-powered coding assistants, They could analyze patient records and suggest codes with incredible accuracy, maybe even going beyond what we're capable of today. Or maybe we'll see blockchain technology being used to, streamline the claims process and make sure that patient data is even more secure.
Wow, those are some pretty incredible possibilities. It sounds like the future of medical coding is going to be quite a journey.
It really does have the potential to completely transform the field. And it's not just about making things easier for coders. It's about making the whole healthcare system more efficient and effective, which ultimately benefits everyone, especially the patients.
That's a great point. I think that's a perfect note to end on. Thanks so much for joining us today and sharing your insights. I really appreciate it.
It was my pleasure. I always enjoy these deep dives.
And to you, our listener, we hope this deep dive has given you a better understanding of the iCoder app and how it could potentially change your coding workflow. Remember, the future of coding is constantly evolving, and tools like iCoder are leading the charge. So stay curious, keep learning, and embrace the power of technology to make your work life a little bit easier, a little bit more fulfilling. Until next time, happy coding.